Isordil Titradose, also known as isosorbide dinitrate, is a medication used to prevent chest pain in patients with coronary artery disease. It belongs to a class of drugs called nitrates, which work by relaxing and widening blood vessels, allowing for easier blood flow to the heart. It's important to note that Isordil Titradose will not relieve chest pain once it occurs, and it's not meant to be taken just before physical activities, like exercise or sexual activity, to prevent chest pain. If you have any concerns or need more information, consult your doctor for personalized advice on the best way to manage your condition. When taking Isordil Titradose, it's important to follow your doctor's instructions. Typically, you'll take this medication by mouth 2 to 3 times a day, at the same times each day. It's essential to stick to the dosing schedule unless your doctor tells you otherwise. To benefit the most from this medication, use it regularly. Don't stop taking it suddenly without consulting your doctor, as some conditions may worsen if you do. Your doctor may need to gradually decrease your dose. If you've been using Isordil Titradose for a long time, it may not work as well and may require a different dosing. If you experience worsening chest pain or it occurs more often, let your doctor know. If you experience headache, dizziness, lightheadedness, nausea, or flushing while taking Isordil Titradose, it may be due to your body adjusting to the medication. Headaches could be a sign that the medication is working, and you can try using over-the-counter pain relievers like acetaminophen or aspirin to help with the headaches. If the headaches persist or become severe, it's important to inform your doctor. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience serious side effects such as fainting or a fast/irregular/pounding heartbeat. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Isordil Titradose, it's important to talk to your doctor or pharmacist if you have any allergies to this medication or similar drugs. It's also essential to discuss your medical history, especially if you have had a recent head injury, low blood pressure, other heart problems, or if you are pregnant or breastfeeding. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness until you know how this medication affects you. It's also essential to limit alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially dizziness and lightheadedness, which could increase the risk of falls. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using Isordil Titradose with your doctor before taking it. When taking Isordil Titradose, it's important to be aware of potential drug interactions. This medication may interact with drugs used to treat erectile dysfunction or pulmonary hypertension, as well as certain drugs used to treat migraine headaches. It's also important to be cautious with products that could worsen heart failure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen and naproxen. Additionally, it's important to avoid using medications containing isosorbide mononitrate while taking Isordil Titradose, as the two medications are very similar. It's also worth noting that this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking Isordil Titradose. As for the daily dosage and optimal timing, it's important to follow your doctor's instructions carefully. They will determine the appropriate dosage for you based on your condition. It's best to take this medication on an empty stomach, at least 1 hour before or 2 hours after a meal. Remember to take it at the same time each day to maintain a consistent level of the drug in your body. If you or someone else has taken too much Isordil Titradose and experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can call 911 or the local poison control center at 1-800-222-1222. In Canada, you can call your provincial poison control center. Symptoms of an overdose may include a slow heartbeat, changes in vision, severe nausea or vomiting, sweating, cold and clammy skin, and bluish discoloration of the fingers, toes, or lips. It's crucial to seek immediate medical attention if these symptoms occur. It's important not to share Isordil Titradose with anyone else. Your doctor may want to monitor your blood pressure and perform other medical tests while you are taking this medication. Be sure to keep all of your medical and lab appointments and consult your doctor for more details. Making lifestyle changes such as adjusting your diet, exercising, and quitting smoking may improve the effectiveness of this medication. Talk to your doctor or pharmacist about any lifestyle changes that could benefit you. If you forget to take a dose of Isordil Titradose, take it as soon as you remember. However, if it's within 2 hours of your next scheduled dose, then it's better to skip the missed dose and take the next one at the regular time. It's important not to take a double dose to make up for the missed one. It's important to store Isordil Titradose at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company on how to properly discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.